They're not the same. Yes, the Pfizer BioNTech and Moderna Covid-19 vaccines do have many similarities. Yes, they are both mRNA vaccines. Yes, both recently received Emergency Use Authorization (EUA) from the U.S. Food and Drug Administration (FDA), with the Moderna vaccine receiving the EUA on Friday, as Leah Rosenbaum reported for Forbes. Both vaccines may enjoy long walks on the beach as long as they are stored properly. However, there are important differences between the two vaccines that may affect vaccine rollouts and who can get each. First, the similarities, because as 2020 comes to a close, we don't want to just dwell on differences in our society. The two vaccines are supposed to work by the same mechanism. Both contain mRNA, which is not like MMMBop, but stands for messenger, small m. Ribonucleic acid, RNA. Every living cell and microorganism has a collection of genetic material like deoxyribonucleic acid, DNA, or RNA that serve as the library of blueprints for making its protein parts. A cell or microorganism can then make copies of these blueprints or recipes form the library in the form of mRNA. These blueprint copies or mRNA then travel to factories in the cell or microorganism called ribosomes. These factories put together the proteins that are specified by these blueprints, i.e., the mRNA. Both the Pfizer BioNTech and Moderna vaccines include mRNA that is supposed to code for the production of the COVID-19 coronavirus spike protein. If you recall, the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, looks like a spiky massage ball. However, rather make you go, "Ah, that feels good." These spikes help the virus enter your respiratory tract cells. However, such mRNA doesn't just sit by itself in the Pfizer BioNTech and Moderna vaccines. Cells in your immune system may not recognize or gobble up random pieces of mRNA that are floating around in your body, just like you may not eat the sugar, corn syrup, hydrogenated palm kernel oil, fruit juice, citric acid, natural and artificial flavor goo that's inside Skittles without the candy coating. Therefore, the mRNA in the vaccines is surrounded by a material that will allow your immune system cells to more readily swallow the mRNA. Consider this material to be akin to a candy coating. Once the mRNA gets inside your immune system cells, the factories inside your cells use the mRNA to start making the SARS-CoV-2 spike protein. Not the entire virus but just the spike protein. Once spike protein is made, the rest of your immune system is supposed to go, "WTH is this," and then mobilize a response against the spike proteins. This hopefully will get your immune system to remember the spike protein and act quickly if and when the real virus covered in spike proteins gets into your body. So far, there are no clear differences between the efficacy and safety of the two vaccines.